Hello, students. You are welcome to study session 3 of epidemiology, which will discuss the core epidemiologic functions. Sit back and enjoy this lecture. Moving to the introduction, the pivotal role of epidemiology was emphasized by the Institute of Medicine in its definition of the substance of public health as organized community efforts aimed at the prevention of disease and promotion of health, with linkages to many disciplines and the scientific core of epidemiology. In the mid 1980s, five major types of epidemiology in public health practice were identified, and a sixth task was recently added. At the end of this lecture, you will be able to define the core competencies of epidemiology, be able to identify and explain the core epidemiological functions. Let's look at the core competencies. Core competencies are defined first for middle level professionals as opposed to junior or senior epidemiologists. Despite the risk of creating artificial categories in the career development ladder, this approach has been taken to facilitate the process. At a later phase, the competencies can be developed for other career stages. The term core indicates that the competencies should be a minimum prerequisite for any field epidemiologist, regardless of the level he or she occupies in the public health administration. The core epidemiological functions, there are five major tasks of epidemiology in public health practice, like I've said earlier on in the introduction. And these include the public health surveillance, the field investigation, analytic studies, evaluation, and linkages. Looking at each core functions one by one. Public health surveillance is the ongoing systematic collection, analysis, interpretation, and dissemination of health data to help guide public health decisions and actions. Surveillance is equivalent to monitoring the pulse of the community. The purpose of public health surveillance, which is to portray the ongoing patterns of disease occurrence and disease potential, so that investigation, control, and prevention measures can be applied efficiently and effectively. Field investigation. One of the first actions that results from a surveillance case report or report of a cluster is investigation by the public health department. The investigation may be as limited as a phone call to the healthcare provider to confirm or to clarify circumstances of the reported case, or it may involve a field investigation requiring the coordinated efforts of dozens of people to characterize the extent of an epidemic and to identify its cause. Analytic studies. Surveillance and field investigations are usually sufficient to identify causes, modes of transmission, and appropriate control and prevention measures. But sometimes analytic studies employ more rigorous methods which are needed. Often, the methods are used in combination with surveillance and field investigations, providing clues or hypotheses about causes and modes of transmission, and analytic studies evaluating the credibility of those hypotheses. The hallmark of an analytic epidemiologic study is the use of a valid comparison group. Epidemiologists must be skilled in all aspects of such studies, including design, the conduct, the analysis, the interpretation, and communication of findings. Evaluation. Epidemiologists who are accustomed to using systematic and quantitative approaches have come to play an important role in evaluation of public health services and other activities. Evaluation is the process of determining as systematically and objectively as possible the relevance, effectiveness, efficiency, and impact of activities with respect to established goals. Linkages. Other team members must maybe laboratory people, sanitarians, infection control personnel, nurses, or other clinical staff, and increasingly computer information specialists. Many outbreaks cross geographical and jurisdictional lines, so co-investigators may be from local, the state, or federal levels, or government, academic institutions, clinical facilities, or the private sector. Let's look at policy development. Indeed, epidemiologists who understand a problem and the population in which it occurs are often in a uniquely qualified position to recommend appropriate interventions. As a result, epidemiologists working in public health regularly provide input, testimony, and recommendations regarding disease control strategies, reportable disease regulations, and healthcare policy. Thank you for listening. See you in the next lecture. Bye for now.